Lately, there has been much more in the literature, and we're seeing much more of the patient who hasn't smoked who's developed a head and neck cancer, and it's that HPV, that human papillomavirus related cancer. And we in the head and neck, we typically see it in the tonsil or in the base of tongue. And so we might see a patient who complains of persistent sore throat, and they've never smoked before. And lo and behold, when we scope them, they do have an ulcerative lesion at the base of tongue, or they've got something going on in the tonsil. Those patients, when I end up taking them in the operating room to do the direct laryngoscopy, and usually I end up having to take out their tonsils, because again, that's one of the primary sites for that type of cancer, we send all that tissue that we take out, we send for HPV typing. So they type it for the various strands or strains of human papillomavirus, and there are a couple HPV 16 and 18 that can be associated with head and neck cancers. They also test it for a protein called P16 protein. The patients who end up having a head and neck cancer, and the most common type of cancer that we see in the head and neck is called squamous cell cancer. It's a cancer that develops in the mucosal surfaces of the upper aerodigestive tract. So you can see it on the lips, you can see it in the mouth, tongue, tonsils, throat. But the people who develop that, who are non-smokers, who have the HPV virus and are P16 positive, their best treatment options are usually chemotherapy and radiation rather than surgery. They respond very favorably to that. The smokers generally benefit from combined therapy, including oftentimes surgery. Certainly, going back to the smokers first, if you smoke and you have a chronic sore throat or difficulty swallowing or ear pain, voice changes, you need to see your primary care doctor, and that needs to go away by antibiotics if it's just an infection, and if it doesn't, you need to be referred to us so that we can take a look. It's a little bit tougher for the non-smokers because a lot of times they will go for months with these symptoms. I would say that if it's anything that concerns you, and particularly if you notice a sore inside your mouth or in your tonsil, you need to be evaluated by us.